Hey there guys, this is Brig Duck. I am just doing a test before I finalize everything, so this is not the one that will be submitted, so I'll probably mess up a lot. It's currently uh, well past midnight right now, and I'm half asleep, so I'm probably going to get a bunch of this wrong. But tomorrow, when I'm more alert, I can record a better version of this. Anyway, let's just do a quick practice run and make sure that everybody likes this. Okay, so my name is Brig Duck. I am the narrator for Group 15, and we are discussing cerebrovascular accidents. So really fast, first of all, what is a cerebrovascular accident? So normally people don't refer to it as that, they would refer to it as a stroke, but it's basically where the brain has a temporary removal of its oxygen supply. Normally that's due to a blockage of some kind. And because it loses its oxygen supply, I don't know why there's a scribble down here, because it loses its oxygen supply, that can actually cause damage to the brain cells. So really fast, just to go through, this is where things get a little bit wild and wacky. We'll start with the etiology of cardiovascular accidents. So the main causes of strokes are basically they're hypertension and emboli. So high blood pressure and circulating fatty plaques or blood clots. But basically, hypertension or high blood pressure, it can damage vessels to the brain or in the brain, which if those were to burst, they can actually fill the cranial cavity with blood, which the resulting pressure basically kills the brain. In addition, it also starves out of its oxygen supply. So in a sense, it's like a two-fronted war there of the brain. They're very, very lethal. Alternatively, there's also embolic. God, why am I so fucking sleepy? Embolic strokes. How did that take so long? Embolic strokes are basically any time that instead of having a rupture of the vessel, you instead have a blockage of the vessel. And that can be caused by everything from blood clots to blood clots to bacterial clots in cases of infection, or even foreign bodies. So I mean, it can be caused by quite a few things, but generally, as far as so generally stroke risk factors are going to be anything that increases blood pressure. So hypertension is the big one, but obviously like diabetes, genetics, obesity. I mean, anything that's going to put additional pressure on your circulatory system is going to increase your chances of having a stroke. So yeah, in addition, there's also kind of the risks for emboluses as well. So normally they're most common during atrial fibrillation. That's because during atrial fibrillation, the atria does not contract properly, and it's unable to properly dump its blood into the right ventricle. And when that happens, blood is able to circulate in the atria and basically form blood clots. And I would love to draw something, but no. Now it's a smiley man. It was going to be a heart, but yeah. So we got that. So yeah, those are the two kinds of stroke. Now it does get a little bit more wild and wacky than that, because they can be actually okay. So well, I guess I'm going even more in depth with this shit. So we got hemorrhagic and ischemic. Okay, hemorrhagic, that's where you got the blood. That is a weird blood drop. And ischemic is where you've got a obstruction. All right. What do we got here? Pathophysi. Okay, yeah. So the pathophysiology of a hemorrhagic stroke. So specifically, this is of a hemorrhage. So we've got bleeding in the brain, normally caused by a ruptured vessel. Oop, got that arrow. But normally it's caused by high blood pressure. Also be caused by aneurysms. But yeah, I mean, if you have a hemorrhage in your brain, then your chances of survival are quite low, because I mean, even surgery is literally just piercing your skull to get that blood out of there, and it is a very fast process, so it is very serious. Ischemic stroke, strangely enough, actually isn't as serious. Now, mind you, no stroke is a joke, if you will. No stroke is a joke. That's weird. Anyway, ischemic isn't as serious. It's basically just any blockage, so it can be caused by anything, but they normally divide them into two different categories, which would be thrombotic strokes. Why did I say it like that? Anyway, and embolic strokes. And thrombotic strokes, these bad boys got those thrombos. Those thrombocytes. Not thrombocytes. God, I am so sleepy. Thrombus. They have thrombi. That's what they have. And when those thrombi are formed and dislodged, they can be stuck in the blood vessels of the brain. It's an especially bad issue with atherosclerosis, but also hypercoagulability, because that increases blood clotting. So we got that. Now, embolic strokes, they're basically the same thing in a lot of ways. And in fact, I would argue that thrombotic strokes are a form of embolic strokes, but I mean, who the heck do I think I am? But basically, so an embolic stroke is any obstruction. It doesn't have to be blood. I mean, it could be a fatty deposit that travels down the bloodstream after coming off, or it could be literally a clump of bacteria that is possible in infections. But basically anything can cause the obstruction, whereas this is very specifically thrombi. So we've got that bad boy. Oh, and I guess I can point out this bad boy down here. Both types. I mean, I guess that's kind of self-explanatory. You don't want any stroke, okay? So I mean, don't be like, oh yeah, if I have to choose one, I'll get an ischemic stroke. Just avoid them. All right, sequela. Okay, so we got the after effects. So when it comes to stroke, like I said, there's not like a good stroke. All stroke causes issues. Now, depending on the stroke that you have, you'll have different neurological issues, but anytime that you're losing brain cells, those brain cells have to have a function in the brain, as far as we understand it. And depending on where exactly that stroke was located in the brain, you can have different neurological symptoms. So, I mean, they can really vary. I mean, you can have motor, sensory, language, or cognitive deficits, and a lot of these actually overlap. So with the motor, you've got like flaccidity or paralysis of the limbs, and I mean that goes into a whole bunch of different things. But in addition, you might actually recover control of your limb, only to have a period of spasticity where you can't control your limb. So yeah, pretty lit stuff right there. We got that. Then you also have sensory defects. So we've got yeah, I don't really understand this one to it, because I feel like sensory would be like kind of under cognitive, because like eyesight and shit. But apparently it's okay. Well, I get this because okay, so you tend to forget the side that had the stroke and contributes to lack of awareness. This is basically like that phantom leg. I'm not writing that. The phantom leg syndrome, same idea, but with the permanently damaged side of your body. Same concept. As far as language deficits, I mean, it can cause all kinds of wild shit. We got, I mean, the Broca's area can be damaged. I mean, Wernicke. I mean, really, it can totally mess up your ability to not only produce language but also understand it. And you might actually be able to speak and not be able to understand other people, or you might be able to not, or you might not be able to speak, but be able to understand other people. So it is kind of scary in that way. And then of course cognitive deficits, and I mean that's kind of general, but I mean you're gonna have like impaired social skills, short-term memory loss. You're gonna have like poor judgment, confusion. I mean it's really like just general cognitive issues. So we've got that. Okay, so manifestations. Now, I mean, I'm going to be like saying the same stuff over and over again because it's basically the same content, but whatever. Okay, anyway, hemorrhagic and ischemic strokes, they have different clinical manifestations. What a surprise. But they share these. So, I mean, obviously it's still a stroke. Basically in both cases the brain isn't getting enough oxygen and brain cells are dying. And as a result, I mean, you're going to see that numbness, weakness, specifically probably more likely will be numbness just because of that. You're going to lose that God, come on, brain. Blah, blah, blah. Yeah, you're gonna lose that. We'll say that we're gonna lose that. Like I mentioned before, you're gonna have difficulty. Okay, you're not going to, but you might have difficulty speaking and understanding others, and that will apply to both. As well as, okay, like confusion, visual disturbances. Okay, so you can have like double vision. You can have issues with your peripheral vision, so you can't see as much as you used to, like around yourself. And then, okay, like balance issues. Basically, your brain has issues coordinating signals that are coming from from the balance center in your ears. And also severe headache. A lot of patients will report it being like the worst headache of their life, like terrible headache. That's pretty common. Moving on. Oh God, this is just lovely. Manifestations of blah blah blah. Okay, I get to repeat myself basically more. Okay. Yeah, so manifestations, you're definitely going to see chronic hypertension because that's pretty common. That's what you would expect with hemorrhagic. Got that. Okay, I'm gonna be totally honest with you. I have no idea what an AVM is, so I'm just trusting y'all on the AVMs. But yeah, I mean, you all the good old-fashioned cerebral aneurysms. Now, it'd be a terrible manifestation, but technically you can see death because hemorrhage will do you. It'll do you in. A dab will do you. Let's see. And yeah, so older individuals and especially young individuals, so like I'm talking like young children and older individuals are going to be very prone to damage. Healthy, 20-year-old adults might have a better chance, better prognosis, but like it's still really bad. Like it's not like you're like talking like, oh yeah, I'm like 5 times as likely to survive. I mean, you might, I don't know, I don't fucking know the statistics, but it's not going to be probably anything wild. Anyway, secondary injury and mortality are higher in hemorrhagic. Okay, and I've mentioned this before. You do not want this bad boy, because blood in your skull is bad news. So we've got that. Going on to my boy ischemic. Okay, so we got bruits. I keep calling bruits. Bruits. Okay, so that would be indicative of atherosclerosis, which leads to ischemic stroke. So you got to watch out for that. Now, also you'd want to watch out for atrial fibrillation. Because that will often cause blockages as well, since, like I mentioned, blood clots form in the atria. We got that. I mean, obviously, yeah, you're gonna see signs of like oxygen deprivation and stuff and all that. That's kind of goes with both, but it's the good shit, really. I'm trying to. On the actual one, I'm not gonna fucking try and do all this. I'm just gonna be like, oh, blah 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 blah, and I'll be done because this is too much. Yeah, the Lacunar infarcts. All right, next. Okay. Treatments, yay! There's not a lot you can do. That's really what it comes down to. First of all, they need a CT scan or a brain MRI. They do that so that they know whether it's a hemorrhagic or ischemic stroke, because otherwise you just know they have a stroke for the most part. I mean, there are some other symptoms, but a lot of their symptoms are shared, so it's hard to tell. Going into specifics though, so as far as treatments, with hemorrhagic stroke, so first of all, okay, so they're bleeding in the brain. So medical professionals, and I'm not talking to us, I'm talking them like them bad boys making like the 6- and 7-figure salaries. They will try to control bleeding. I don't know how you do that inside the skull, but I presume, you just cut that bad boy open and stick a band-aid in there or something. I don't know. But that's going to be number one. You have to stop the bleeding. Otherwise, it's guaranteed death for the most part. But after the stroke is over, this is where like the real kind of like treatment kicks in. I didn't understand this, but this was put on there, so whatever. But the patient should be kept mildly hypertensive with the goal of normalizing blood pressure. I'm assuming, and I added this should help the brain to receive more oxygenation. I feel like that would be why. I don't know. I don't know why you would, because high blood pressure causes stroke, so I don't know why you would want them to have high blood pressure. I almost wonder if that's supposed to be like hypo. Anyway. Treatments are relatively similar to those used on TBI victims. Oh yeah, so traumatic brain injury victims, so like a car accident, you'd basically use the same exact methods of saving them because they're both massive traumatic brain injuries with bleeding. So they are very similar in that sense, just from different sources. And of course, the patient should be monitored closely, so they should just be watched, and have vital signs checked. You should not be like sending them home, like, oh, give us a call if your brain cracks open or something. Don't like do that. Otherwise, yeah, I mean, they should rest. For the most part, because it's in their brain, there's not a lot that like we can do to help them heal. A lot of it is up to their body, and of course, a lot of it will be permanent damage. Anyway, moving on over to the old ischemic, my boy. We got, okay, so ischemia is an infarction, or not infarction, but is it literally an ischemia? Yeah, I think an ischemia. Anyway, infarction's correct technically too. Anyway, we need to minimize the size of whatever is blocking the artery. And we need to, while doing that, hopefully preserve neurological function. So we got to like act fast and all that. So we use a few different things. Thrombolytic therapy, as you can suggest, it lyses the thrombocytes. So destroys thrombocytes, or I guess it's thrombi. Anyway, it destroys those, which then cannot form thrombi that would otherwise clog up the arteries. So yeah, that's pretty sweet. Similarly, anticoagulants, same idea, except they prevent clotting of the blood cells, which could cause an ischemic stroke. So we got that. Endorectomy and angioplasty are kind of the same thing, but basically it's a surgery, and they crack open your artery or your vein or whatever needs repaired, and they repair it. And angioplasty is just a repair. And endorectomy is like they remove the plaque. I don't know how the fuck they pull that off, but they do. Just scrape it out with a spoon or something, I'm sure. And yeah, so we got those. And finally, stents. Okay, so stent is literally just like a tube that you just shove right down in their stenotic artery, and that will hold it on open so that that blood can flow through. And that way, it's less prone to closing over time as well. So we got that. Okay, and that is most of it. So I made this NCLEX question. I was like, hell yeah, let's NCLEX it. An ischemic stroke is often a consequence of other pathologic abnormalities within the body. Isn't that insane? Which of the following is the most likely to result in an ischemic stroke? Okay, well, it's atrial fibrillation, if you recall. That causes a backup of thrombi. I can't write and it's late at night. These other ones would not be correct, because low blood pressure, get out of here. No, high blood pressure would cause it. Die. Overexertion, I mean, I guess, but that's not the best answer, so get NCLEXed, my dude. Deep vein thrombosis, no, my dude. I mean, technically, yes, it's a thrombosis. That would get you. You'd be like, ooh, thrombosis. But here's the thing, is that is a deep vein thrombosis, my man squeeze. That is probably quite far away from the brain. And that is a blockage of a deep vein. And so the chances of that thrombosis fucking skedaddling through your body and getting to your brain are pretty low. So I'd say nah, my dude. And finally, ventricular fibrillation. In VFib, your ventricles, they pump so inefficiently that they can't actually like feed your body. And when that happens, they also cannot feed your brain any thrombi. So, if they can't pump blood, then they can't pump the thrombi. So that just leaves my main squeeze atrial fibrillation. Any hoodles. And finally, our grand references page. Really, I'm assuming you guys got most of the content from this bad boy. That's kind of what I did, so I really hope that's correct, and if it's not correct, I hope he doesn't look too hard. I know nothing about where you guys got your shit. I don't want to know. Anyway, and finally, for that one extra thing we needed to get, I've got that right there. And yeah, that is our study guide. Please let me know anything that concerned you. Obviously, I'm not going to be saying wild and wacky words. I will try to keep some energy in it when I do it, but I'm not going to, like, curse at our professor. So yeah. Okay, thanks.